Hi, my name is Stephanie Cho. I am a doctor at Keck Medicine of USC. My job is that I am a psycho-oncologist. What that means is that I work with people who are going through a new diagnosis of cancer, and specifically breast cancer, and help them navigate the emotional roller coaster that can be. I'm a cancer survivor myself, and I still remember what my experience was like. And that is why I do what I do. I want to try to help others get through their own experiences. It will be different for everyone. I remember that for me, there were times throughout the diagnosis and treatment that my emotions would go all over the place. When I was first told that I had breast cancer, I remember feeling this overwhelming sense of dread and fear and doom, feeling like I needed to stay strong and positive for my family and my friends. A feeling of relief when I knew what the treatment plan was and we were going to start chemotherapy. And then expecting to feel really great and relieved when my treatment was done, but not actually feeling that way. I remember feeling really confused and frustrated as I was processing everything that had happened to me through the whole diagnosis and treatment time. Those were my emotions, and everyone is going to have a different experience, but for everyone, it can be something that really takes an emotional and physical toll, and that affects your entire well-being. Because of that, I want to take this time to share 3 tips on how to get through the emotional aspect of a cancer journey. The first is assign a team captain. And what I mean by that is, assign someone who you trust, who's going to help you get the help and support you need. A cancer patient has so many things to deal with while going through treatment, making appointments with a bunch of different doctors, setting up child care or pet care, managing what's going to happen at work, and all the daily responsibilities that someone normally has. But that, in addition to managing one's own cancer treatment, is really difficult, and it's a lot for anyone to bear. And because of that, a team captain can be really helpful in kind of corralling up the help from the loved ones, family and friends who want to be able to help. I usually suggest that it's either a close family friend or a family member who does this. And for some people, it can even be someone who's out of town or sort of farther away, but still is very close and really wants to help. It can be hard sometimes because I know for me, giving up these responsibilities or letting someone else take care of them felt like I was losing control over parts of my life. But what it really is that I was having trouble allowing others to help me because I was so used to taking care of myself, my friends, my loved ones. And this is a period of time in your life to let others help take care of you. The second thing is to look for red flags. During the cancer treatment process and the entire journey, there are going to be times when you're not feeling great, when physically you're feeling nauseous or tired, you just don't really have the energy or motivation to go do things. That's all completely normal, and that unfortunately does come with a lot of treatments. But there are times when it's something I call a red flag, when we want to be sure that we're taking a look at something and making sure there's not something going on underneath. The biggest red flag for me is when someone stops enjoying the things that they usually love. And it's not just not having the energy to do it, but it really is that once you're doing it, you don't feel that enjoyment, that joy that you used to do. For some people, it might be spending time with friends and family. For others, it might be cooking or gardening, reading or writing. No matter what it is for you, if that's something that happens, that's when I want you to stop and call your doctor right away so we can make sure that we're giving you the support we can and preventing this from worsening into a depression. The last thing that I want to tell you, and I really tell everyone, is that it's okay to not be happy. You don't have to be happy all the time. In our society, it's something that's actually known and called the tyranny of hope, which is that during cancer treatment, someone who's undergoing the treatments really feels the need to have to be happy and positive the whole time. They have to be fighting. Anything less than that is letting the cancer win, and that's not acceptable. But this is real life, and this is a real experience, a life-changing experience that you're going through. And it's okay to not be happy all the time. I know that for me, going through my own cancer journey, there were times when I was angry, frustrated, and really actually just wanted to give up and just be done and stop treatments. And all of that, it can happen, and there's not something that's wrong with that. It's something that everyone has to kind of go through and make their own emotional way through the journey. Every day you'll see a new article about avoid these 5 foods to avoid cancer. And I remember whenever I would see those articles, I felt guilty. I felt like if there's just something else I could do, if I had just tried harder. And that's our way of trying to answer the question of why me? That everybody feels. And it's important to remember that that is an emotion, that other people feel it too. But being able to experience those emotions and allow yourself to live through the process and enjoy and cherish the happy moments that do come is what helps get someone through the process. I remember that through my treatment, there were a lot of really difficult parts. My life changed a lot. And I really had to sort of, in some ways, arrange my life around my new cancer treatment. And that was hard. But I made it through because of the support that I allowed my family and friends to give me, and the support and the guidance and treatment that I got from my medical team. And we here at Norris Comprehensive Cancer Center want to do that for you and want to try to help you through your cancer journey as best as we can. If you're wanting to meet us and wanting someone or a team to help guide you through your journey, go ahead and give us a call at 1-800-USC-CARE.